Well, we're talking about lung cancer screening, Ron. We have Dr. Talmage Shill here from Davis Hospital and Medical Center. Thanks so much for coming in.
Happy to be here.
And I guess most at risk for lung cancer would be people who smoked, right?
Yes,
absolutely. Okay, and how many people is that?
Well, the risk of dying from lung cancer is 220,000 a year in America, and that's mostly related to smoking. Okay. All of it, essentially.
But is it, the screening can find it early?
Yes, and that's a very important point, that if we can find a lung cancer early, it's potentially curable. And so what this National Lung Screening Trial Test offered is it gave us results showing 20% reduction in death related to lung cancer for the high-risk population if they had a low-dose lung screening CT scan.
Okay, and you're offering those kind of screenings. Who's at risk, I guess? People, maybe somebody quit smoking 30 years ago.
Okay, if you quit smoking 15 years ago and you haven't had any problems, you probably don't qualify for a lung screening program. But if you've smoked for what we call a 30-pack year history, and what that means is if you smoked 1 pack a day for a full year, that's 1 pack year. If you do that for 30 years, that's 30 pack years. You smoke 2 packs a day for 15 years, that's 30 pack year.
30 pack years.
Yeah.
Okay, and the risk is there could be some kind of a lesion?
That's correct.
And you can detect that with the screening before there are any symptoms?
Absolutely before those symptoms.
And you're offering these screenings, right?
Yes, yes, we're offering them at Davis Hospital. It takes about 10-15 seconds to get the screening completed, and it's a very low radiation risk.
Okay, and you're trying to make them affordable?
They're very affordable. Okay. Under $100 for a simple lung screen. If you combine a heart view scan with the lung screening, $150.
Okay, now who should go? I mean, if you could grab one person and say, you need to get screened.
Very important question. People 50 years and older who have a 30-pack year history, like we talked about, or a 20-pack year history, also 50 years and older, with an additional risk factor for lung cancer, like COPD, prior radiation, a family history of lung cancer.
Okay, and it can be caught and detected and treated. There are different treatments, surgery and probably other things.
Radiation, lots of options.
Okay, all right, could help you live a lot longer.
Absolutely.
Make it worth quitting.
It is worth quitting.
Dr. Shill, thanks so much.
Thank you.
We will take a break and be right back.